Hey, welcome everyone to our fourth webinar of 2024 for our Lunch and Learn webinars. And today we'll be talking about effective communication. And I'm Jan Garrett, and I'm the Deputy Director of ADA Programs. And I'm so pleased to be here today with Savannah Bradley. And I'm going to let Savannah introduce herself. And maybe we should move to the next slide. Oh, okay. And so Savannah can introduce herself, and then we'll talk about the ADA Center.
All right. Hi, everyone. My name is Savannah Bradley. I am the Community Outreach and Programs Manager for the Pacific ADA Center. Before we start with our presentation today, just a few reminders. We will have the slides and recording link available to you all by next week. Any previous Lunch and Learn webinars that we've done recently can be found on our YouTube page. We'll do Q&A at the end of our presentation today, so feel free to put your questions in the chat. And please take our evaluation survey. We'll put that in the chat here shortly so you can open it up and have it in a tab to take right after the presentation or when you have time later today. We'd greatly appreciate your feedback there. Jan, is there anything else that you want to mention before we get started?
No, I don't think so. I think we can go ahead and move forward.
All right, wonderful. Okay, so starting with who we are. So the Pacific ADA Center is one of 10 national centers that are part of the ADA National Network. So this slide has a map that shows the 10 regions of the ADA National Network, as well as the ADA National Network logo above it. And our mission here at the center is to provide resources, training, and support to improve awareness and understanding of the rights and responsibilities under the Americans with Disabilities Act. And again, I mentioned that we're a member of the ADA National Network. So here at the center, we provide confidential information. We provide that by phone and by email on the ADA. We provide trainings virtually as well as in person. We provide conferences twice a year. So we have a virtual conference coming up next March. We have resources and referrals that we can make for a person's needs. We have a website, which we'll provide in the chat and in the slides at the end of the presentation. We don't provide advocacy services, and we don't provide legal advice. And if you contact us by phone or by email, we also don't report your contact info to any enforcement agency. So overall, we're here to provide information, materials, and resources about the ADA. We don't provide advocacy, enforcement, or report anyone to an enforcement entity. All right, so what are some disability awareness basics? So never assume that someone with a disability needs help to do something, or that you know how to help them. If you think someone might need help, you can politely ask them, may I help you or may I assist you? And if they say yes, you can follow up by asking, how can I help you or how can I assist you? If they do need assistance, they'll more than likely be happy to tell you how to provide it, might give you some instructions. And if they don't need your assistance, don't take it personally. Some more things to avoid: don't speak loudly unless you're asked to do so. Never talk to the sign language interpreter, instead talk to and acknowledge the person. Never move a mobility device or a white cane without asking. Never grab a blind person by the arm and direct them without permission, and never rush someone with a speech disability when they're communicating. So what is the ADA? It's a civil rights law, and we are coming up on its 35th anniversary next July, so that's exciting. In general, the ADA protects people with disabilities from discrimination and provides an equal opportunity. And the overall goal is the full inclusion of people with disabilities in all aspects of American society. So the ADA has 5 titles or sections. Title 1 is employment. So this covers all aspects of the employment process. Title 2 is for state and local governments. Title III covers public accommodations, so which are private businesses and private nonprofits that are open to the public. Title IV covers telecommunications, so this makes sure that people with hearing or speech disabilities have access to telecommunication services like phone calls through relay services, for example. And then Title V is miscellaneous. So this includes how you enforce the ADA and what things apply and don't apply when you're talking about the ADA. So in general, the ADA says that any of these entities that are covered by these five sections or titles, so whether that be employers, state or local governments, private businesses, or private nonprofits, these covered entities must provide reasonable accommodations to applicants and employees with disabilities, if you're in the employment area, must provide accessible locations for their programs, if they're in state or local governments, they must all provide accessible websites, and they all have to provide reasonable modifications to some policies and procedures. And they also must provide communication aids and services for people with hearing, speech, and or vision disabilities. And we're going to talk more about effective communication here in a moment. All right, so how does the ADA define a disability? So it's defined in three sections under the ADA. The first section is physical or mental impairment that substantially limits one or more major life activities. So there's a lot of major life activities to consider under the ADA. On the right of this slide, there's a list of some major life activities. So that includes walking, seeing, hearing, speaking, breathing, cognitive functioning, concentrating, normal cell growth. So think of cancer in this instance, and many more major life activities. So the second section of the definition of a disability under the ADA is having a record or history of such an impairment. So maybe you don't have the impairment anymore, but you have a history of it. And then the third one is being regarded as or assumed to have such an impairment. So if it is assumed that you have an impairment or a disability and you're discriminated against, you are covered under the ADA. So state and local governments are covered by Title II of the ADA. So a person with a disability must be able to use any building or outside area, so think of like a park, and use any services that are run by state and local governments. So any programs that are offered have to be accessible. And if you can't make it accessible in an older building, then you need to be able to offer it in a building that is accessible. So some examples of state and local programs that need to be made accessible are state and local government health centers and clinics, public libraries, summer recreation programs, public housing, and websites. So this is not an exhaustive list, but these are some examples. And then when entities are private, but they're open to the public, they're considered public accommodations. So people with disabilities have the right to buy things from, enter, or use the services of a private business or private nonprofit organization that is open to everyone. So these are considered public accommodations that are covered by ADA Title III. Public accommodations must remove accessibility barriers that are readily achievable. This often means a barrier that is low cost and easy to remove in their buildings that were built before the ADA. I know my colleague Jan likes to say there is also no grandfathering of any building built before the ADA. I wanted to be sure to bring that point in today as well. Of course, any buildings that were built after the ADA, those are already required to be completely accessible and meeting the ADA standards. These public accommodations, they also must modify some policies or procedures and provide effective communication as well. So some examples of places of public accommodation are places like restaurants, stores like clothing or grocery stores, movie theaters, centers for independent living, private health clinics, and medical or dental offices. All right. That was a lot of information about the ADA, and that brings us to our first poll of our webinar today. So we want to hear from each of you in the chat, thinking back to how the ADA defines a disability. What are some of the major life activities under the ADA that may be substantially limited for people? So name 3 major life activities. So the options are A, walking, seeing, or hearing; B, thinking, learning, cancer; C, camping, living, swimming; or option D, which is both A and B. So go ahead and drop your answers in the chat. Okay, thank you for your engagement here. I see a lot of D's, I see some A's. D, both A and B. Okay, great work. Yes, it is both A and B. So it is walking, seeing, hearing, thinking, learning, cancer. So these are all some examples of major life activities. Okay, so now we'll talk about effective communication. And at this point, I will hand it over to Jan.
That's great. And thank you. Your answers to the poll show that you're listening to us and that you're understanding, or you're watching through the interpreter. And we really appreciate your attention so far. So now we'll get into more in depth about effective communication. So next slide, please. And just so you know, we're going to be on slide 15 now. So in general, public accommodations and government entities or government agencies have to provide people with vision, hearing, and or speech disabilities equal communication access to their goods, programs, and services. And this slide is showing sort of 3 images of like a speech icon, a person walking with a cane to elicit a vision disability, to represent a vision disability, and then the international symbol for hearing loss. So it's people with vision, hearing, and or speech disabilities under the ADA are entitled to effective equal communication to access the goods, services, and programs. Next slide. So when does effective communication apply? Written and verbal information has to be as clear and understandable to people with communication disabilities. Again, those are vision, hearing, and or speech disabilities. Um, so that communication must be as clear and understandable as it is for people without disabilities. And this icon on the screen is showing various icons that represent different disabilities. So the effective communication requirement in the ADA applies to people who are participants in state or local government agencies, or who are customers or clients in public accommodations. That might be a private business or a private nonprofit. So it would apply to anybody who is a participant, any member of the public, and any companions of participants or members of the public. So it applies to everyone who to whom communication is otherwise given. Next slide. So on slide 17, we're going to talk about some considerations for effective communication. You need to look at the nature, the context, the length, and how complicated the communication is to determine what means or what effective communication means you will offer. You also need to look at the way the person chooses to communicate. So you need to ask them, how do they need communication to be delivered to them, particularly for longer or more complex communications? And remember that you cannot use family members as sign language interpreters except in a true emergency. And even in an emergency, it's only until another interpreter can arrive. So you need to look at how long the communication is, how complicated it is, how does the person need to have their communication, and make sure you're not using family members except in an extreme emergency. Okay. So, how can communication be effective? It has to be provided through auxiliary aids and services, which is what the ADA says. That's another way of saying communication aids and services is the way that you provide effective communication. So let's learn about those communication aids and services. Next slide. So these can include qualified sign language interpreters. So qualified meaning they're qualified to interpret for that particular setting. For example, in the medical setting, there are interpreters who have received specific training to interpret in medical settings so they know the terms that pharmacists or doctors or nurses might use. So, a qualified sign language interpreter is an example of one communication aid or service. A certified deaf interpreter can also be an example. This is someone who is also deaf, but who might be able to communicate with the other deaf person more effectively than an interpreter that is only trained in American Sign Language. So the American Sign Language interpreter and the certified deaf interpreter work together to communicate with the deaf person. And you need to be able to find out if that deaf person might need a certified deaf interpreter in addition to an American Sign Language interpreter when you are requesting interpreters, if that is necessary. Some people don't know sign language because they become hard of hearing or deaf later in life. So for them, real time captioning might be important. And again, on this webinar, to provide effective communication, we have both an American Sign Language interpreter and we have real time captioning with a live captioner, not auto captioning. So it's very, very important that you provide, whenever possible, real time captioning for people who don't know sign language, but who also cannot hear what is happening. Also, assistive listening devices can be provided to people who are hard of hearing and where you are using a public address system, some sort of microphone system. You can provide assistive listening devices. There are many different types, and the type that you provide really depends on the setting that you have, whether it's a small meeting room or a big conference room. It really depends on the setting that you're in. And again, you would want to talk to the person if they are requesting an assistive listening device about what type of device works for them. Also, telephone relay services. Many people use the relay service, and this is nationwide service. They can call 711 and communicate with an operator who can sign with them or who can understand their speech and can then communicate to a person that they want to call, whether that is 911, whether that is to order a pizza, whether that is to make a doctor's appointment, any kind of communication that that person with a speech or a hearing disability might have, they can use the relay service, again, which is nationwide, to be able to make that phone call that they need to make. You can also, in a very short conversation with someone, exchange written notes if they can read your writing and you're writing very simple notes back and forth. May I check out this book? Yes, it is due back on January 14. That's very simple note writing, or even texting back and forth that you can do. Keep in mind that people who are deaf, English is not often their first language. And so if you're writing notes back and forth, you need to keep it simple. And if you're talking about someone who is blind or has a vision disability, exchanging notes will not be effective. You need to verbally communicate with them. And if they are deaf blind, you need to make sure you have an interpreter that can communicate with people in a way that deaf blind people communicate. Also, for people with vision disabilities, having alternative format materials can be very important. That can include large print. We usually say, make that at least 18-point font, make it a really simple, what's called a sans serif font, really basic font. An example is what we use in these slides. Um, Also, Braille. Some people may need Braille as an alternative format. Other people may need an electronic document to be able to read something with their tablet or with their computer. Again, ask the person with a disability what they need in terms of their communication. So, again, for people with visual disabilities, you may want to provide alternative formats through the electronic documents. Many people now, including us on our last slide that you'll notice, are using more QR codes. That means somebody blind can hold their phone up and take a picture of the screen or take a picture of a document that they know is in front of them. And that QR code will lead them to a website or some sort of document that they can then read electronically. So QR codes can be an example of visual information in an alternative format. And also, of course, as I just mentioned, large print and Braille. You also may use a qualified reader, just like a qualified interpreter. This is somebody who is qualified to read the document. So, for example, if it's just a really simple, even training slide, it may not need somebody that can read that well, or can somebody that can read a menu may not be a complex qualified reader, but somebody who needs more information, like, for example, a car, signing a contract to buy a car, you need a qualified reader, or signing a mortgage to have a loan for your house. You're going to need a qualified reader if that's how you are accessing the written material. Next slide. So, video remote interpreting is another kind of interpreting that can happen when you don't have an in person interpreter. So, this is defined as an interpreting service that uses video conference technology, sort of like we're using today on Zoom, but a different kind of direct conference technology over dedicated lines or wireless technology. There are very specific, important requirements for video remote interpreting to make it effective. That includes high quality video and audio that are clear, real time, with uninterrupted images, dedicated high speed connection so that the video and audio can come through without interruption, clear video that is sufficiently large and sharp that shows both the person who is deaf and the interpreter's face, arms, hands, and fingers, because sign language is done not just with the hands, but with the entire upper body and the hands, arms, and face. Also, make sure that the video remote interpreting, or VRI, has clear and easily understood voices so the interpreter knows what to interpret. Make sure that it is quick setup and that you train everybody in how to set it up and how to use it. Don't just train one person in how to use the video remote interpreting because maybe that person is off that day or is on a vacation for 2 weeks. You need to train everybody that could be needed to set up and run that video remote interpreting. And that is super critical to train people in that. Next slide. So real-time captioning, as I mentioned earlier, this can be for people with hearing disabilities who do not know American Sign Language or ASL, but they can read. And a real-time captioner types on a stenotype machine with a phonetic keyboard and special software. And there is a picture showing somebody typing on that type of stenotype machine. And if you ever have seen courtroom settings, the courtroom um, typist is often using a stenotype machine. Then what happens is the captioned words will appear on a screen or even a tablet that the person has in front of them. And just like interpreters, captioners can be in person or remote. And more captioning is being done remotely. Next, next slide. So assistive listening devices, they amplify sound and may connect with hearing aids that people may wear. And they are useful when they are linked to a microphone or a public address system. They're not useful unless you are using some sort of microphone or public address system. So, as I mentioned earlier, there are many different types of assistive listening devices, and the type that you use really depends on the room and event that you are having. It can be a hearing loop that is like a metal loop that goes around the room that people can connect to with their hearing aids. It can be an FM system that operates over radio waves. It can be an infrared system. But again, if you break the infrared signal, it's so if people are moving around in the room and interfering with the signal, infrared is not going to be a good system for that. You can use personal amplified systems. Some people have their own amplified systems. And then there are also Bluetooth amplified systems that people can use, remotely that don't have to connect to anything. Next slide. So relay services can be used by people with hearing and speech disabilities who call 711 across the country and then can connect with a relay operator. Now, most people connect with the relay operator via a computer these days, but some people still might use a TTY to connect with them. Um, and they might even use, a telephone. So a hearing operator interpreter relays the call between the person with the disability and the person that they are trying to call. So they might interpret back what the person on the other end is saying to the deaf person. And when the deaf person signs to that relay interpreter, the relay interpreter then voices what the deaf person is trying to say to the person on the other end of the call. There are also interpreters that understand people with speech disabilities and can help voice what that person is saying also to the person on the other end of the call. Just like with any disability, and effective communication means train your staff on taking relay calls so that they do not hang up. People may hear, hello, this is relay service operator number 1801. Have you taken a relay call before? And they may assume that's a robocall or a prank call. It's not. It's a relay service operator with someone on the other end who needs to use the relay service to make that call. So train your staff not to hang up on those folks. Okay. Next slide. So again, using notes, um, For brief, simple conversations, passing notes or writing text may be fine, but keep in mind that English is often not the first language of a deaf person, particularly a culturally deaf person with a capital D, deaf. That person's first language may be American Sign Language. And so keep the notes simple and brief. If you need a longer conversation or if it's going to be a more complex conversation, it's likely that if that person uses ASL to communicate, that they're going to need either video remote interpreting or an in-person interpreter. Next slide. So for speech disabilities, some people use what are called augmentative and alternative communication, or AAC devices. AAC can include communication methods that are used to supplement or replace speech or writing. So a computerized AAC device can be programmed by somebody who wants to say something that has a speech disability. They press the keys and then the device says what the person wants to say. It does take a little time to type that in and have the device say what the person wants to say. So you need to be patient and allow them to input what they want to say. Other people may use a communication board where it has common words or an alphabet or a numbers area. Again, watch what they're pointing to and use patience when they are communicating with you to allow them to complete what they are trying to say. Next slide. Okay, so those are the major areas of effective communication, and we're on slide 27 now, and we're going to go to poll number 2. So name types of auxiliary or communication aids and services. A is alternative format materials like large print. B is real-time captioning. C is shouting at someone who is hard of hearing. And D is both A and B, both alternative format materials like large print and B, real-time captioning. Oh, see, everybody is saying D. A and B, D. Perfect. Perfect. You guys were paying attention when we said don't shout at people unless they are, unless they ask you to speak up to them. So that's really, really important to understand. Okay. So we are now moving to slide 30. So for effective communication requests, always ask what type of communication is effective for the person. Many people do not consider themselves to be people with disabilities. In fact, people who are culturally deaf, who have grown up deaf, consider themselves deaf, but not necessarily people with disabilities. So people don't need to use the term quote unquote disability to request effective communication under the ADA. They also don't need to use the words effective communication. They just need to say, I need help with communicating. I need help with talking to my doctor or my pharmacist. I need help with reading the information that you're going to give me after this visit, or I need help with understanding the slides or reading the slides that you're going to give me for this training. Any of those kinds of statements is enough for an effective communication request. And requests do not have to be in writing. So don't require people to make a written request for effective communication. Also, every staff person should know where to direct their request, someone's request for effective communication. whether that's alternative format written materials, whether that's a sign language interpreter, whether that's a captioner. Every staff person that works in a business, a nonprofit, a state or local government should know where to direct a request for effective communication so that that person can make that effective communication happen when the person has the appointment or when that person comes in. Next slide. So in healthcare, almost all healthcare discussions are going to need an American Sign Language interpreter if that's what the person, the patient, or the family member with the patient uses ASL. Because healthcare discussions are so critical and so important that you really need your preferred method of communication and not just exchanging notes back and forth. Video remote interpreting might be okay in certain circumstances, and particularly in areas where in person interpreters might be hard to get and come by. It is a poor choice. Video remote interpreting is in an emotionally charged discussion or during labor and delivery when a woman is lying on her back trying to give birth and is having to communicate with an interpreter through a tablet. You really need to make sure that there is an in person interpreter whenever possible for those kinds of issues. Again, use patience with people who have speech disabilities. Even when appointment times are limited in healthcare, make sure that you are allowing them time to ask their questions and provide alternative formats to patients and family members with vision disabilities for forms or diagnosis information or follow up information or patient instructions. Make sure that you know what alternative format the person needs and provide that. So that is really, really important. Next slide. So, how do you know when communication is effective? Public accommodations, which are private businesses or private nonprofits, they can actually choose which communication aid or service to use. Government agencies, so state agencies, cities, counties, have to give primary consideration to the person's request for communication. So if that request is for a sign language interpreter, the government agency has to give primary consideration to that request, whereas the public accommodation can choose what communication aid or service to use. However, it is important, whatever communication aid or service you use, the communication must be effective always. And so you understand and you know it's effective when the person shows that they clearly understand the information. They're responding appropriately. You can even ask them occasionally to repeat back what they understood if you're not sure if they're understanding. So make sure that the communication is clear and that the person is understanding the communication. Next slide. So there are some challenges in effective communication. Wearing masks can make lip reading difficult. Now, nobody can understand everything through lip reading. Only the best lip readers understand about 20 to 30% of communication when reading lips. But when you're wearing a mask, you can't read lips at all. And sometimes lip reading can help when you're also gesturing and lip reading. So wearing masks can make that and make the communication difficult in general. Shortages of in-person interpreters, especially certified deaf interpreters, but even American Sign Language interpreters. They can be difficult to find in rural areas and in other areas, particularly on short notice. The wait time for an in-person interpreter in an ER or another emergency situation can be long, unfortunately, which is why it is good to have video remote interpreting to fill that gap until a live interpreter, an in-person interpreter can come. Also, some places have lack of Wi-Fi, even for video remote interpreting. Try to make sure that you have the best Wi-Fi available or that you have a dedicated line, a dedicated internet line for that video remote interpreting. And then other staff shortages may make reading of written materials difficult. So people may need to have things read to them at a time when staff are available to read it to them if they have vision disabilities. Next slide. So we're going to talk, we're on slide 34 now, and we're going to talk a little bit about the defenses and other issues that come up with effective communication. So this can be what nonprofits or businesses or state and local governments can say if they cannot provide the effective communication. One defense is an undue burden. And what that means is a significant difficulty or expense. But you must look at all resources of that state or local government agency, of that business, of that nonprofit, all the resources available for use in the funding of the operation of the program have to be considered. Not just one particular program, but the entire city budget, the entire county budget, the entire business budget, the entire nonprofit budget have to be looked at to consider if something is a significant expense. Also, the head of the agency or the organization or someone they identify or designate has to decide if something is an undue burden. And they must document the reasons behind the undue burden decision. They cannot simply say, this is an undue burden. They have to document why it is an undue burden for them to provide this particular method of effective communication. And one tip that we tell people, we tell government agencies, we tell nonprofits and businesses, budget for effective communication, budget for access of all kinds, budget for making sure that people can get into your business and move around it, budget for an interpreter when you might need it, budget for captioning when you might need it, budget for a reader or for Braille if you might need it. So have that in your budget as part of your normal operations. Next slide. So a fundamental alteration is also a defense, and that is a modification so significant that it alters the essential nature of the goods, services, facilities, privileges, advantages, or accommodations offered. Again, the head of the agency or the organization or the business or someone they designate or identify has to decide if something is a fundamental alteration. And that is a really significant alteration. And again, you have to document the reasons behind the decision that something is a fundamental alteration. So, an example of a fundamental alteration could be requesting interpreters for a meeting at 2 a.m. when it is not an emergency. Okay. 2 a.m. is generally not something, not a time that a meeting would typically happen. So that could be considered a fundamental alteration of how you are doing business um, to have a meeting at 2 a.m. Next slide. So surcharges. Neither public accommodations nor government agencies may place a surcharge on some people with disabilities or on groups of people with disabilities to cover the cost of complying with the ADA. Examples could be charging for the use of a sign language interpreter. You cannot do that. Or charging for Braille documents. Again, you cannot charge people with disabilities for the effective communication that they are requesting. Next slide. So at this point, we're on slide 38, and I know someone had, Hillary had raised their hand, but I'm wondering if we want to, if there are any questions in the chat that you have seen, Savannah, before we go to the people who have raised their hands.
Yes, so I scroll to the top and I can read them out loud. So the first question I see says, does ADA help with disabled housing questions?
Well, housing is often covered by the Fair Housing Act if it's private housing, but if it's government housing, it may be covered by the ADA. If you call your regional ADA center, and we will give you contact information on the last slide here, you can reach somebody who can give you information about housing, whether it's ADA related housing or Fair Housing Act private housing. So we would be happy to do that for Region 9 folks, but for people who are in the other regions, they are happy to answer your questions about housing.
All right, next questions. Can we get the slides for this session? Yes, we will provide the slides and the presentation link within a week to everyone. How do we turn accommodation violators? So how do we report maybe?
Um, so could the person maybe clarify in the chat, if you want to um, make a complaint about something that you think is a violation of the ADA, you can make a complaint with the U.S. Justice Department at ada.gov. And that is a very good site to go to in general about ADA rights. That's the U.S. Department of Justice website. You can also make a complaint to your state civil rights or human rights department. And you can file a private lawsuit if you have an attorney that you know of that can take your case. Um, but generally, people start with making a complaint to Department of Justice, to their state civil rights or human rights department. You can also contact your protection and advocacy agency or disability rights agency in your state to make a complaint. And so, feel free to contact again your ADA center if you want to know more about how to enforce your rights under the ADA or other disability rights laws.
Okay. Next question. Would places of worship be under the Title III public accommodations of the ADA?
Excellent question. Places of worship are actually not covered by the ADA at all. And the reason is there is a separation of church and state in the US Constitution. However, places of worship are often covered by the building code of the state in which they are and in which they offer their worship services. So they may still have to provide accessible facilities. Now, in terms of effective communication, some state laws also can apply to houses of worship, places of worship that say that you must also provide effective communication and that you cannot discriminate against anybody with any disability for any reason. So make sure that you're looking at your state laws because people are here from all over the country today. I don't want to mention any specific state law, but again, contact your ADA center. They will know the state disability laws that apply, and they will be able to tell you if those laws might apply to a place of worship. So, excellent question.
Next question. Is foreign language covered under the ADA? Who is responsible for accommodating foreign language speakers?
Foreign language is not necessarily an ADA issue unless it is somebody who communicates in a different sign language. There are different sign languages that are not American Sign Language. Again, you would contact your ADA center. We know of interpreter referral agencies, and those agencies will often have interpreters or relationships with interpreters that speak other languages. But otherwise, no, the ADA only covers people with disabilities, not people that speak other languages but don't have disabilities.
I see another question. It says, does this apply to staff workers or public entities? Maybe you can help us in the chat expand a little bit more what part of the presentation you're referring to there.
Yeah, I'm not
In,
sure how to answer that.
in the meantime, let's see the next question. Many medical places are refusing to provide an in-person sign language interpreter, as they say they're only contracted to use VRI. Is this a direct violation?
um, they cannot simply say, well, VRI is sufficient if the person really needs an in person interpreter. Indeed, they may only have a contract with VRI, but they need to look at having in person interpreters as well. And it really, again, it depends. It really depends on the situation as far as whether or not they really need an in person interpreter. But it could be that it is much more effective to have an in person interpreter in certain healthcare situations than it is to have a VRI. So simply saying we only contract with VRI is not usually sufficient in terms of compliance with the ADA.
All right. Next question. Can you please explain why you might want to use VRI instead of VRS? I have a hard time understanding the difference now that VRS can be used with the video option on a cell phone.
Well, yeah, you can use video relay services. But typically, the relay service is not meant for situations where you are supposed to have an interpreter. It is really meant for a call to call. It is not meant for a meeting or an appointment or a training or something like that. That is not what relay services are for. They are for person to person interaction and typically with a call. Um, and so it is not really designed or meant for that type of thing. And VRI or in person interpreters would really be what's needed for those types for trainings or appointments or meetings.
All right. Next question. What provision of the ADA should I cite to show that the definition of the term disability under Title I includes a person with cancer?
Under Title One. Well, you can contact your ADA center and we can provide you, the ADA center can provide you with the specific section of the ADA that talks about the definition of disability, and that includes major bodily functions as major life activities. And that's why cancer is considered a disability under the ADA, is because it is a major bodily function that is interrupted. So normal cell growth is interrupted in a cancer situation. And so that is now part of the definition of disability. And we would be happy to provide you with that section of the ADA if you will contact your ADA center.
All right. Next question. Does any part of the ADA require that agencies make their available accommodations, request, and grievance processes easily findable on their website and various means of patient communication? That information is often impossible to find, and disability questions should be included at the beginning of a patient profile and intake forms. I just completed a check-in questionnaire for a doctor's visit, and their link to their language assistance services was at the end of the questionnaire.
Okay, well, whether you're talking about healthcare or other things, state and local government agencies are required to have a grievance process, a grievance procedure. It's a good idea for private businesses and private nonprofits to have that as well, to somebody that you can contact, but it's only required under the ADA for state and local government agencies to have that kind of a grievance procedure. Yes, it really should be easily findable and accessible on that Title II or public entity's website, along with their ADA coordinator, which is usually who the grievance goes to. But often it is hard to find. We certainly understand that, and the ADA does not specifically say that. But it does say that you need to provide notice and you need to provide it in a conspicuous way. So I think that really speaks to making it easy to find on your website and on all your forms that you put out there in the public. And ultimately, of course, in a couple of years, public, state, and local government agencies are going to have their websites and their mobile apps, including healthcare apps, accessible. So that's an important thing to watch for. That final rule is already out, and they have until April of 2026 to comply. If they're a large entity and if they're under 50,000 people, then they have until April of 2027 to comply with that. So make sure that you're putting out there how people can contact the ADA coordinator. And if you're a business or nonprofit, make sure you're putting out there how people can reach you as well for effective communication and other types of modifications or accommodations.
Okay, we have time for a couple of more questions. So I'm going to try my best to scroll through the chat. The next one I see says, can a public entity require advance notice of accommodations that require an outside service or process, such as having Braille documents created, having an ASL interpreter on hand, etc.?
Yes, you can require advance notice. Um, Typically, you need to already have the contract with the sign language interpreter service. You need to already know who you're going to use for Braille services, and be able to provide that in a reasonable amount of time. So hopefully, there's no specific time frame that the ADA says that you're required to give for advance notice, but it really needs to be reasonable. I would say, a few days to a week, and make sure that you are, stating that clearly that you need that advance notice and that you can follow through with the request.
Okay, can you talk about filing an ADA complaint and how these regulations are enforced?
Again, go to ada.gov with U.S. Department of Justice. Also, if you are employment, you can go to eeoc.gov to file an employment claim. Again, I would contact your ADA center for more information about how you might actually want to advocate for something to change or to actually file a complaint about an ADA related claim. And I just wanted to say, I know we didn't get to the people who raised their hands. I'm so sorry about that today, but please contact us. We're going to move to the next slide here that Savannah is going to talk about how to contact us. So please do that. And take our evaluation survey. Really encourage you to do that. The link is now in the chat for that. So
Yes,
Savannah, I'll turn it back to you.
wonderful. And I see some very specific questions as well in the chat. Please call or email us. We'd be happy to help you provide referrals as well that you are in need of. So some helpful resources to close out our webinar for today. We wanted to provide our website link. There's also a link to the ADA National Network. We have some links for the U.S. Department of Justice. You can learn more about the ADA there as well. There's information on how to access medical care for individuals with disabilities, and there's a fact sheet on effective communication. We're also putting some links in the chat there for you to access. And then please stay in touch with us. Again, you can call us. It's free. It's confidential. You can also email us. We have a team of technical assistants that are eager to speak with you. We have our website again, and then you can join our email list so you can stay up to date on any future events that we have. We're also putting the evaluation link in the chat. Once again, please take that survey, give us your feedback. We'd really appreciate it.
Thank you
And
so much, Savannah. And thank you to everyone for joining us and for participating with us. We really appreciate that.
thank you, everyone.
Thanks, everyone.